Welcome to the Walk-in Care, a case study on how HealthInfoNet services can assist urgent care clinical workflows. Let's start with the course objectives: to identify and review the top walk-in care use cases and interventions, to understand how to use the data and tools available in the Health Information Exchange, and we sometimes call it the HIE, to support the treatment and management of care of walk-in care patients. And lastly, to learn how other walk-in care teams are using the HIE in their routine clinical workflows to improve the quality, safety, and coordination of patient care. So let's start. How are urgent care teams using the HealthInfoNet services to meet their needs in a walk-in clinic? This slide is going to show you the three main reasons would be to first support acute care illness and injury assessments, and to promote improved communication and coordination, and also to incorporate walk-in care treatment plans within longitudinal health records. And how we do that by providing the data is to retrieve critical health information on patients' activities throughout the state, regardless of the treating provider's organizational affiliations. Also, we're able to allow you to review patients' previous PCP notes, ED visits and hospitalizations, active problems, chronic conditions, allergies and medications, screenings, and vaccinations, as well as imaging and laboratory results, and other helpful data points to conduct informed medical assessments. And also to enhance patients' confidence and satisfaction by providing urgent care providers with information that is typically available only to providers with ongoing relationships with the patients. So how we promote improved communication, how does that work? We enhance and expand communication methods and data accessibility across various types of providers and system of care. We facilitate patients' transitions to primary care, behavioral health, or emergency department settings, depending on the severity of the ailment and illnesses, or to follow up care as needed. And lastly, to help urgent care providers educate patients on the appropriate use of the walk-in care settings based on the reviews of personal health record information. We help to incorporate treatment plans within the records by diagnostic services, for example, STD tests, pregnancy tests, drug tests, screening tests, flu, rapid tests. Those are the things that we do in a walk-in clinic, and be able to get that to the providers quickly. Preventative health services, vaccinations, school and sports physicals, child exams, workers' compensation exams. And also to give patient care teams complete views into their patients' health, wellness, and well-being to better monitor progress, identify care plans, and make informed recommendations. We wanted to share with you that who the Health Exchange is connected to. So these are the connected organizations in Maine, and they're all the healthcare systems, acute care hospitals and critical access hospitals, a majority of the ambulatory facilities, and all federally qualified healthcare centers, or FQHCs, laboratories such as Nordex Quest, Doll Chase, and others, SureScripts and Maine Care, pharmacy data sets, some behavioral health and post-acute facilities, and also the Maine Emergency Medical Services. So you can see our data is throughout the state from a lot of different facilities and organizations. What is available in the clinical portal for your view as a walk-in clinic provider and a healthcare worker? demographic information, allergies with their adverse effects, medical history. We're developing documentation of social determinants of health, different encounters throughout the state, diagnoses and problems, vital signs, immunizations, radiology reports, lab and micro, as well as mental health supports and services. So you can see there's a lot of data that when a patient walks into a walk-in clinic and you're not familiar with this patient's history, the information is given to you in a very comprehensive way for you to quickly assess the patient's past history. Some of the people that are using the clinical portal throughout the state are nurses, medical assistants, physicians, behavioral health clinics. We have medical records and referral specialists, care managers, population health nurses, epidemiologists, infection prevention staff, as well as quality analysts. So a lot of information are using this data. Here's a screenshot of what the clinical portal is. I will go through that in a little bit of information about how the clinical portal works and how you can look at information quickly for the walk-in clinic. How HealthInfoNet can help a walk-in clinic is to assist with acute care illness and injury assessments, promote improved communication and care coordination, as well as incorporating walk-in care treatment plans within longitudinal health records. Now let's look at HealthInfoNet's value proposition. I like this slide because it's pretty visual on some of the common walk-in care challenges, such as gathering comprehensive information about a patient, particularly one that you've never seen before, establishing necessary communication methods across the systems of care so that the patient's primary care doctor would know that you were actually seen over the weekend, maintaining patient confidence and satisfaction. And that is when we're able to get the data readily available so the patient doesn't have to wait around or sees that the provider doesn't have all the information to make a good decision on how to take care of the patient. And lastly, to ensure that the walk-in care treatment plans are incorporated into the patient's longitudinal health record. And this is for ongoing care and follow-up as needed. So if these are our challenges on this target, this is where the common HIE solutions can be found. And how we do that by improving communication and care planning activities, by identifying patients' relevant gaps in care and most recent health changes, obviously to administer the most effective care plans and detect impacts to their health, well-being, and wellness, to provide comprehensive and accurate information at the point of care. Again, making sure that the patient can see that the provider is well informed, has the information at his or her fingertips, just means so much to a patient that's sitting there anxious about their care. And lastly, to continuously build on a patient's record by real-time information captured from all the different providers, but also from the walk-in clinic to the patient's record. At this time, I'm going to change slides and just give a little clinical portal demonstration. So here we are in the clinical portal. A lot of you who are listening to this webinar have already used the clinical portal. And those that have not, you're going to be able to see what is available and then let you know that you have access to this tool and you too can learn how to use it. And I'll go through the training processes in just a moment. So here is just a quick overview of what is available in the clinical portal. On this portion of the clinical portal, which is called the patient summary, this is where you would go first to find 5 basic information data on your patient. The first one being demographics, their primary care doctor, as well as an emergency contact. The next one would be all the different allergies as well as the reactions and the severity, and also who sent the data. Where was this data collected and who sent it to the clinical portal? Thirdly is active problems. This is a great tool. This information comes to us through ICD-10 coding. The most recent is always on the top. Again, it lets you know the location of the source of information and data that was sent to us. This may be a lot longer, so you will notice down here when you see that there'll be a next and a previous, which will go to a second page where more data can be found. Make sure to check on that when you want to look at the full comprehensive active problem list. Fourthly is the drug medication prescriptions dispensed. Pretty comprehensive here. Lets you know the dose, the prescribed by who, the pharmacy, and the instructions. Always very important when you're taking care of patients. And lastly, these are the encounters, and this is where the patient has been seen, registered, and been seen by a healthcare provider, such as the emergency room. They could be an inpatient in a hospital setting or an outpatient. We have many new visit types, and you're going to notice those when you look at that, such as observation. That's a good thing to know sometimes, that your patient was just an observation. Now they're in the walk-in clinic. What happened? What happened during that observation visit? So this is very good information. Also, what is good about this is because these columns have an asterisk next to the title of the column, means that you can hover. And that's going to tell you a real quick snapshot of why was the patient in the emergency room? And also, where is the source of the data? So again, this first page here is very good at getting a real quick overview of the patient's health status. But it is this column over here with all of these documents that will help support the data over here and give you even more information. So for instance, if you knew someone was recently in the hospital and you wanted to look at their discharge and history, when you open that up and when you click on a particular discharge summary, you will now see it in this screen, which you're able to print out if you wanted to bring it to the provider that might be seeing the patient in a room to review what was done on the discharge summary. We have emergency, we have immunizations, laboratory is color-coded, again, for quick reference, where black is normal, yellow has an abnormality, and red is a critical value. So just by looking at this information quickly, I can tell that there's a couple critical values here with this person's blood work with their hematological results. So good information really quickly. Again, let's just show you what it looks like when you open up the CBC. Here it comes in this view again with the breakdown of the different components. So again, very good information at your fingertips. Here's micro, here's operative, office visits, and radiology. This tool in training, I go over to tell you how to sort the data to look at it easily and quickly. When you're in this field, you may want to get back to it. So just by clicking on patient summary, you are able to refresh the screen. We also have behavioral health data that can be found behind this protective screen. As you all know, behavioral health is highly sensitive and protected. However, some patients may opt in to have their behavioral health information readily available for you. May be very helpful in a walk-in clinic. You don't know the patient, and they may have some behavioral health issues that may be contributing to their anxiety or depression, and bringing them to the walk-in clinic. If they've opted in, you're going to be with their behavioral health organization specifically, you're going to be able to see that readily. But if they did not give permission. As a healthcare provider, you are able to break the glass in an urgent and emergent situation. If you, as a healthcare provider, deem that necessary, you can break the glass by using this link right here to view the information temporarily. The other way you can view it is if the patient gives you permission. It may not be an urgent or an emergent situation, but you are asking the patients a few questions. They are not able to remember some particular information about their behavioral health. They can give you permission if you ask them, may I look at some behavioral health information in the exchange? I will be able to look at it for just 3 days. After that, it'll go back in the shielded side. But what I get may help me to help you today. So that's a good way to advocate for your patients to be able to look at that data. And let me just quickly show you what that looks like if it is urgent or they give you permission. When you click, there's a very specific disclaimer that says, I'm breaking this glass because of emergency care, or I've explained to the patient or their legal representative that I'm looking at the data and the reason why. You must click on this little box that shows that you've read this, and then the reason why. It could be the emergency reason, or you're an ambulatory center, so you can use that, and then put the reason why you're accessing this information. Audits are done regularly, and particularly on behavioral health, to make sure patients' data is protected. And once you break the seal, the information will be available for 3 days, and then after that, it'll go back in the shielded side. Let me show you what happens when you break the glass. Over here, there's a little bit of a change going on, and now I have sensitive data displayed here, and there's a document in there that I may want to look at that might help with the patient care. So wanted to show you that as well. And then after 3 days, the information will definitely be back in the shielded side. So now that we've finished with the demonstration, I hope that was helpful. Let's read a walk-in care user testimonial from a provider who uses health information exchange in his walk-in clinic. This is from Jim Galia. He's an MD, Emergency Services Medical Director at Stevens Memorial Hospital. And he states, quote, I use HealthInfoNet to help get records on prior ED visits, hospitalizations, imaging and lab studies, and procedures, mostly surgeries and cardiac procedures, done at hospitals outside of Maine Health. Given our location's proximity to Lewiston, Bridgeton, and Rumford, we typically use HealthInfoNet as our access point for information through the CMHC, which is Central Maine Healthcare System. This can be very helpful given that patients do migrate between hospitals and hospital systems for a variety of reasons, unquote. So everything that I've said up to this point is said right here by a physician who actually uses the tool. So thank you, Dr. Galia, for that information and that testimonial. As I stated before, I wanted to share with you the training and education opportunities for you. One of the ways that you can get education is through the HIN Academy, which you're familiar with. And but some other ways that you can get it is through personal support, where our education team, myself and Nicole Yo-Fisher, are available to do Zoom education training for your staff. And you can reach us at clienteducation@healthinfonet.org. We have online courses, which is the HEN Academy. We have videos, we have regular webinar series. We have a lot of training resources. We have an expansive repository of online resources on our website, and we have a communication package, which really works in helping you to share with your patients the information about what the exchange is, to advocate for them and help them to make a good medical decision about whether they want to have their information available or not. So let us know if you need any of that information. And here's the clinical education team, myself, Sharon Barra, and then Nicole Yo-Fisher. Here's our contact information. Please feel free to reach out to us. And I want to thank you very much.